So what is STOP survey? STOP stands for Studying Tobacco Users of Pakistan. This survey was conducted in 2019 initially. It was conducted to provide regular and timely information of smokers of urban areas of Pakistan to inform policy and practice. The reasons behind conducting the STOP survey: firstly, the infrequent national surveys like GAT survey, which was last conducted in 2014, lacked depth and flexibility on contextual emerging issues of tobacco use in Pakistan. Secondly, there were inflated estimates of illicit cigarette trade which were provided by the tobacco industry itself. Hence, there was a need for an independent estimates, or rather a surveillance, a timely and a regular surveillance to inform the policy and practice. Lastly and most importantly, the Tobacco Control Cell in Ministry of Health requested University of York and the initiative to provide independent estimates of illicit cigarette trade before the 2020 budget. STOP survey, being a household face-to-face cross-sectional survey, was conducted in 10 most populous cities of Pakistan, in which we approached approximately 97,000 households, out of which 6,014 smokers were randomly selected to be interviewed. Alongside the consumer survey, the face-to-face survey, we introduced a new method of collection of discarded cigarette packs to be examined by collecting them from waste recycle stores of the same areas where the household survey was conducted in the 10 most populous cities of Pakistan. We found in our STOP survey that 17.8% of cigarette packs were illicit, which the smokers were using. Approximately 30% of the smokers were buying single loose cigarette sticks, which is illegal in Pakistan, and around 13.8, nearly 14% of the smokers paid less than the minimum retail price for cigarette packs. These major findings were presented to the Tobacco Control Cell Ministry of Health before 2020 budget in the form of a fact sheet. In context of Pakistan, where we know that the tobacco industry interferes a lot in the policy making, and they lobby against the increase in tobacco taxation. So we believe that in the 2020 budget, these findings contributed hugely towards the government making a decision not to decrease tobacco taxes. After the STOP Urban Survey, we conducted STOP Rural Survey in 2021-22, which was conducted using the same methodology as the STOP Urban Survey in the 5 rural districts, most populous 5 rural districts of Pakistan. We conducted this face-to-face household cross-sectional survey in 85 villages of Pakistan, where we approached approximately 25,000 households, out of which we had approximately 2,500 tobacco users were interviewed. The only difference in the STOP Rural Survey and the STOP Urban Survey was this time we included all tobacco users, the smokers, the smokeless tobacco users, the hookah smokers, all of them. The information which we were collecting in the STOP survey was to assess the proportion of illicit cigarette packs used by the smokers in these areas, in these identified areas. Also to assess the attitude of smokers towards the tobacco control policies. Furthermore, to assess the triggers, the motivation, the methods used for quit attempts. The main findings in the STOP Rural Survey were 89% of illicit cigarette packs were used by the smokers, and more or less 43% of the smokers paid less than the minimum price, whereas buying loose cigarettes, it was around 25-26% of the smokers bought loose cigarettes. In between the STOP Urban and Rural Survey, we had the opportunity of conducting 2 telephonic surveys using the same cohort of smokers which was initially used in the STOP Urban Survey in 2019. The first telephonic survey was conducted in 2020 during the COVID, in which we investigated the psychological, social and economic impact of the pandemic and its responses on those same cohort of smokers. And the second telephonic survey was conducted to study the trends of tobacco use after the increase of tobacco taxes in 2023. After disseminating all the findings from all these surveys to the stakeholders, a need emerged from the policymakers to gather evidence regarding tobacco use, awareness of tobacco control policies, and appeal or susceptibility of tobacco products among adolescents. Considering this, currently we are conducting a study, tobacco control policies regarding plain packaging and taxation for improving the health of adolescents in Pakistan, in the short form, namely TAP. Such surveys like the STOP survey, which provide a wealth of evidence to the policymakers to keep them informed when they are making decisions, appropriate, impactful and timely decisions for the general public, keeping their health as a priority.